Scenario: a young man who presented with chest pain. Post-operatively introduce yourself and take permission. Good morning. I'm Dr. Kamal, one of the surgical doctors working here. May I confirm your name and age, please? Good morning, doctor. My name is John, and I am 47 years old. Nice to meet you, Mr. John. How can I help you today? I've been having some chest pain that's been getting worse over the past 3 hours. I'm sorry to hear that, Mr. John. I will give this oxygen mask and we can continue our conversation. Analyze the main complaint using Socrates: site, onset, course, duration, character, radiation, timing, severity, aggravating and relieving factors, and associated factors. Mr. John, where exactly do you feel the pain? Here in the middle of my chest. When did the pain first start? I told you, doctor, 3 hours ago. Mr. John, how has the pain changed or developed since it began? It's getting worse. How long does the pain typically last when it occurs? It's consistent. How would you describe the type of pain, e.g., sharp, dull, stabbing? Stabbing, I would say. Mr. John, does the pain spread to any other areas? No. Is there any specific time of day or activity that triggers the pain? It started just 3 hours ago. Mr. John, on a scale of 1 to 10, with 10 being the worst pain imaginable, how intense is the pain? 8. Mr. John, does anything make the pain worse or better? No, it's consistent. Have you noticed any other symptoms or factors associated with this chest pain? Yes, shortness of breath. Does the breathlessness come and go, or is it constant? It comes and goes, but in the last hour, it's been more frequent. Differential diagnosis 1. Pulmonary embolism. Mr. John, have you noticed any coughing, bringing anything up, or any blood when coughing? Yeah, I cough often, and there is a taste of blood in my mouth. Have you been experiencing breathlessness? Yes, that's what I told you. I apologize for asking the same question. Let's move on. Have you had any recent surgeries? Yes, I had total hip replacement 4 days ago. Mr. John, have you experienced painful legs? Yes, I'm glad you mentioned that. All right. Have you been ill or had a fever recently? No, I haven't had a fever, but I have been feeling generally unwell. Thank you for sharing that. 2. MI, myocardial infarction. Does the pain move to your left arm? No, doc. Do you ever get breathless when lying flat? No, I don't get breathless when lying flat. Do you ever wake up gasping for breath, Mr. John? No. 3. Chest infections. Have you been ill or have a fever? Yes, I have been feeling unwell, but I haven't had a fever. Do you get a wheezy chest? No, I haven't experienced any wheezing. 4. Chest malignancy. Mr. John, how has your appetite been? My appetite has been normal. Have you noticed any unintentional weight loss? No, I haven't noticed any unintentional weight loss. 5. Musculoskeletal pain. Mr. John, have you been experiencing muscle or joint pain? No, I have not. Have you had any history of trauma? No. Past medical and surgical history. Did you experience similar symptoms in your past? No, doc. Mr. John, do you have any other medical conditions? See your GP for anything? No, I don't have any other medical conditions. Have you had a history of surgeries? Just the total hip replacement. I told you about family history. Is there anyone in your family complaining about the same? No one I'm aware of. Social history. Mr. John, I would like to ask you personal questions. Is that okay? No problem, doctor. Go ahead. What do you do for a living? A teacher. Nice to hear that. Who lives with you? My wife and my son. Mr. John, do you have any difficulty with stairs at home? Yes, climbing the stairs has been challenging lately. Do you smoke or drink alcohol, Mr. John? I used to smoke 1 pack a day, but I quit a few years ago. I don't drink alcohol. Idea, concerns, and expectation, ICE. Before I go any further, could I ask what you think the cause is? I have no idea. Mr. John, what are you the most concerned about? This chest pain. What are you hoping for us to do for you? Fix the pain. Thank you for sharing your ideas and concerns. We'll consider them while conducting further tests. Rest assured, our main goal is to provide you with the best possible care and find answers to your health issues. Systemic review, start from head to toe to make it easy. Mr. John, have you had a headache? No. Any tummy pain? No. Any problems in passing urine? No. Any muscle or joint pain? No. Anything else you want to add? No, that's all, doctor. Thank you, Mr. John. I will discuss this with my senior and get back to you shortly. Discussion, present your patient. Mr. John, a 47-year-old male with chest pain for the past 3 hours, described as stabbing and rated 8-10 in severity. He also experiences shortness of breath and coughs with a taste of blood. The patient had a total hip replacement 4 days ago, no history of MI, and no unintentional weight loss or changes in appetite. He had painful legs before the chest pain. No other significant medical conditions. He stopped smoking a few years ago. What are your differentials? Pulmonary embolism, MI, chest infection, musculoskeletal pain, gastrointestinal issues. Possible causes of chest pain, such as gastritis or peptic ulcer, anxiety or panic attack. Psychological factors should be considered as they can mimic serious medical conditions. How will you investigate your patient? First of all, I will do full clinical examination, including cardiopulmonary examination. Then I will request imaging, CT pulmonary angiography, CTPA, to visualize pulmonary arteries and detect blood clots. Duplex ultrasonography of the legs to check for deep vein thrombosis, DVT, a common cause of pulmonary embolism. Blood tests, ABG complete blood count, CBC, to check for abnormalities, such as anemia, and assess platelet levels. Blood chemistry, to evaluate kidney function and electrolyte levels. D-dimer test, to assess for the presence of blood clot breakdown products in the blood. Electrocardiography, ECG, to look for specific changes in the heart's electrical activity that may indicate strain or damage due to pulmonary embolism. How will you treat your patient? I will treat this patient according to the care of Critical Ill Surgical Patient Protocol, CRISP, starting by ABCD approach, then according to the risk of thromboembolism. If low risk, unfractionated heparin 80 international unit per kg IV as bolus dose, then 18 international unit per kg till APTT be between 40-60 seconds. High risk, thrombolysis or embolectomy.
Thank you, doctor. You can proceed to the next station.